The mental status examination boot camp has been divided into 4 parts, and part 3 will cover the following topics related to cognition. Cognition is a broad term defined as the mental act or process of acquiring knowledge, as well as the understanding of thoughts, experiences, and sensory information. Cognitive testing is used to evaluate and provide evidence for neurocognitive and neurodevelopmental disorders, such as dementia and ADHD. We will discuss some of the commonly tested areas of cognition in this video. To the right are some examples of how to formally document some of these areas of cognition. One thing to note here is that although there are many ways to test cognition, cognition is not always formally assessed during every single psychiatric interview. This is because if a patient is able to hold a back-and-forth conversation during a psychiatric interview, it is safe to deem the patient's cognitive functions as grossly intact. Spending 5 to 10 minutes on a patient with cognitive testing takes away from history gathering during the psychiatric interview, especially if you can only spend a limited amount of time with a patient. In addition, cognitive testing of acutely decompensated psychiatric patients may not be valid. For example, an elderly patient with severe depression may have temporary cognitive impairments related to severe depressive symptoms and may be wrongly diagnosed with dementia.
Orientation is comprised of 4 different components: person, place, time, and situation. Although this is not necessarily formally tested during each psychiatric interview, you may want to consider asking some of these questions if you are concerned about impairment in cognition, such as a patient with delirium or suspected dementia.
Attention can be defined as the ability to register sensory input and then direct their own cognitive processing toward the sensory input. Concentration can be defined as the ability to sustain attention on a specific task. Together, attention and concentration simply mean the ability to focus and appropriately shift mental attention to the topic at hand. Attention and concentration are not always formally tested during a psychiatric interview. If a patient can have a back-and-forth conversation and answer questions appropriately, then attention and concentration are relatively normal. If you do decide to test attention and concentration, here are some examples of what you can ask. With these methods, you're really testing attention, concentration, and short-term memory at once. A patient must first register the sensory input of the task, hold it in their short-term memory, and complete the task using their working memory. During this time, the patient must maintain attention and concentration on the task at hand.
There are several types of memory, including immediate, short-term, intermediate, and long-term memory. You may also hear the term working memory. Some people consider short-term memory as a part of working memory, while others consider working memory to be the same as short-term memory because they are so similar. Taking a closer look, short-term memory is defined as a temporary storage of information, whereas working memory is a patient's ability to use and manipulate the information that they have stored for a short period of time. Long-term memory can be further divided into semantic memory and episodic memory. Just as with attention and concentration, memory is not always formally tested during a psychiatric interview. Depending on the topics discussed during the interview, if a patient is able to have a back-and-forth conversation and answer questions appropriately, then you can consider the patient's memory as adequate. One way to document this is to write, "Memory not formally assessed, but adequate based on recollection of recent events and medications and how they are taken."
Concrete and abstract thinking are not always formally tested during a psychiatric interview, but it is important to understand the meaning of these concepts in case you do need to assess a patient's concrete and abstract thinking abilities. Concrete thinking refers to the ability to interpret statements literally. On the other hand, with abstract thinking, one is able to consider other meanings and make interpretations about statements. An example of concrete thinking would be if you ask a patient what brought them to the hospital and you receive an answer of the ambulance, whereas a more abstract answer to the question would be the patient telling you the circumstances and events leading up to their hospitalization. Some ways you can test a patient's concrete versus abstract thinking is through similarities testing. You can ask the patient to describe how two objects are similar. For example, in what way are bananas and oranges similar? The answer would be that they are both fruits. If the patient provides an inadequate answer, you can ask them to explain what they mean. Another way to test a patient's thinking is to ask the patient about the meaning of certain proverbs. You can first give the patient an example of a proverb interpretation, and then ask them to interpret the meaning of a different proverb. Here are some more examples of similarities or proverbs you might use when testing a patient's concrete versus abstract thinking.
Executive functioning is a concept that includes multiple parts, including the ability to generate goals and plans and maintain focus and motivation in order to complete these specific goals and plans. Executive functioning tasks require multiple parts of the brain as well, including the prefrontal cortex and additional areas outside of this section of the brain. Executive functioning is not always formally tested during the psychiatric interview. However, if you were to test a patient's executive functioning, you might ask the patient to name as many words as they can that start with a certain letter. This is just one of many examples. The main thing you are doing is providing the patient with some instructions to follow for a specific amount of time.